It's now time to send it over to Ebony, who's standing by with details on a procedure that can help you overcome muscle pain.
Yeah, Nicole, have you ever heard of dry needling? Well, if not, Todd Hooks is here from Champion Sports Medicine. He's going to tell you all about it. Good morning.
How are you doing this morning?
Doing all right. And tell us about dry needling.
Okay, dry needling is a technique that was first described by Janet Travell. She was the physician for President Kennedy and President Johnson. And basically it described using a needle, a solid filament needle, without the use of medications such as lidocaine or marcaine or corticosteroids. So it's a dry needle.
Okay. And how does it work? Because it sounds like it's acupuncture, but you say it's different.
It's similar in the fact that, and here's some video footage that we've got right here. And what we're doing is I'm looking to find and locate a trigger point within a muscle. Okay. And a trigger point is common when we're talking to people, is a knot. You've said I may have a knot in my shoulder or your back or whatnot. And what it is, a trigger point is a local muscle contracture within a muscle. It's a localized area. And within that, it contains an altered vascular state. It has decreased oxygen, and therefore it has an altered chemical environment. And what this can cause is these neurotransmitters can be present within this trigger point. It can be the primary source of a patient's pain and or dysfunction, cause a muscle not to really activate correctly.
So I know when I look at acupuncture, just kind of stick the needle in somewhere and leave it, but you're actually going in. What are you waiting for?
Yeah, if you kind of notice in that video right there, what we're looking at is we're eliciting a local twitch response.
Okay, because I did see the arm jump a little bit.
Yeah, if you kind of look at the hand right there, I'm actually can feel some of those within my fingers. But if you're looking at the hand, and I think the next video here, you'll see within the shoulder there, and you'll see kind of a jump of the muscle itself. So it's a twitch response, and what that is, and you can look at the hand right there.
Okay.
Yeah, some of those you'll see, and some I'm feeling as well. But what you're doing is you're inactivating that twitch trigger point.
So does that make the knot go away? Essentially?
Yeah, exactly. It makes it go away.
Oh, gosh, so who needs a massage when you're doing dry needling?
Yeah, so, it's kind of somewhat a localized massage, if you want to think of it that way.
So what types of problems can be treated?
Really any kind of musculoskeletal problem. I work at Champion Sports Medicine, and we see a lot of high school athletes, college, professional. I do a lot with Alabama Ballet. And so it can be people that are very strenuous, trainers, athletes, those type of things, or even weekend warriors, runners, just tennis, people out playing, so they've got tennis elbow. So any type of musculoskeletal condition could benefit from trigger point dry needling.
So how do I know if it could benefit me? Like if I'm having a pain, how do I know if I need to come see you?
Yeah, well, first off, you may describe your pain as a deep, diffuse, achy, sometimes difficult to really localize versus, point to one particular part. It can be kind of difficult to localize. I see a lot of patients for the second and third referrals. So if you've tried other forms of therapy or other treatment regimens, you could potentially try this to see if it could help.
So tell us why we may not have heard of dry needling before, because I didn't hear about it until today.
Right, yeah. Well, it was first allowed in Maryland in 1984. And since then, it's kind of gradually gained steam, if you would. It was allowed for physical therapists to practice in 2008. So it's still kind of a relatively new procedure. I work with a company called MyoPain Seminars, MyoPain, M-Y-O, Pain Seminars, and I do some teaching with that company. So there's some information on that website as well, too, to kind of gain some further insight of trigger point dry needling.
And myphysio.com.
Correct.
People can find you there maybe to make an appointment?
Right, yeah, I work at Champion Sports Medicine. We're at St. Vincent's. The number there is at the bottom of the screen right there, 939-1557.
All right, give him a call today, myphysio.com, for more information. Very interesting. Very interesting.
Thank you.
Maybe next time we'll let you do a live demonstration.
There we go, yeah.
We'll be twitching all over
there
the place.
There we go.
All right, we're going to take a quick commercial break, but we'll be back with more talk of Alabama. Stay with us.